Hello and welcome to a new Nursing Institute podcast. Today we will be talking about pain clinic post-procedure phone calls. My name is Talar Ainedjan and I'm the nurse manager for Pain Clinic and Neurology Clinic. Today we have with us also Mariam Al-Hushaimi, assistant nurse manager, and Albert Bargamento, one of our pain clinic nurses. For today, we will be talking about the post-procedure phone calls that we are conducting in Pain Clinic. We started doing the project when there was JCI audits, and it was one of the opportunities that was found in order to enhance the patient care delivered to patients post their um, procedures in Pain Clinic. In order to do that, we needed to put together a project where we could conduct the procedure phone calls, as well be able to monitor the data and then enhance the workflow and also improve patient outcomes. Um, Albert, I know that you worked very hard on this project and you are still leading this project. Can you tell me what was your role in promoting the workflow for the post-procedure pain clinic workflow?
Okay, thanks so much, Tyler. So the post-procedure phone call started in December of 2021, but the official audit began in March 2022. This was when the post-procedure phone call was incorporated in the reason for call drop-down tab in Epic. This is to ensure that each phone call is captured and counted by the audit team. Another important aspect of our protocol is setting clear expectations to patients before they discharge. Like our nursing team ensures that the patient understands what to expect after the procedure. This includes what symptoms to watch out for and when to seek for medical attention. And the post-procedure phone call, we also conduct it with the help of a professional interpreter. This is to ensure clear communications with all patients. The phone call is conducted within 5 to 15 days after the procedure, allowing us to monitor patients' progress and identify any issues with the patients to address it in a timely manner. And we also conduct manual audit with weekly report submissions to monitor compliance closely. These audits help us identify any areas of improvement and to comply consistently with the post-procedure phone calls, meeting the standards.
Excellent. Thank you, Albert, for sharing that.
Thank you, Tara.
Mariam, can I ask you, when Albert mentioned about monitoring and auditing, how were we able to gather the data for this project and show that we are doing well with the monitoring of the performance of the caregivers conducting the phone calls as well as patients' feedback?
Thank you, Talar. We started in December 2021. We submitted the request to the EPIC team, and we had an added on tab for the reason for call, that is post procedure phone call pain clinic. We shared with the EPIC team what are the list of procedures that we do in the pain clinic, what is our inclusion criteria and what is our exclusion criteria. Based on that, we started getting a report from the EPIC team in February 2022. On our data dashboard, this report was showing us like how many calls are being done for patients after the procedure. And then the team verbalized that there is a discrepancy between what we are getting on the dashboard and what they are conducting, because they are 100% conducting the calls and it's not reflected on our dashboard. Then we agreed to have like a team lead who is Albert, and then a backup nurse to support when he is away. And we agreed to do like manual audits based on our like inclusion criteria: who to call, what procedures, and when to call the patients. We agreed on that. And then the team started the manual audits, like we are sustaining those manual audits. We receive a weekly report by the team lead or the backup nurse on like how many calls were conducted, And so far we are sustaining our results up to 100% based on the inclusion criteria. And we as well compare with our dashboard to make sure that this is consistent, like both data are the same. The team is honestly doing a great job in calling patients and making sure to follow up on them, making sure they are okay after the procedure, and this would enhance our patient satisfaction and patient experience journey in the pain clinic.
That's great. That's great. Thank you for sharing that. As Maria mentioned, the nurses that were involved in this project are actually still involved. We were able to train them and to give them the tools so that they can accomplish this initiative. And whenever we have new joiners to the team, we do the same. We train and we prepare them so that the project is sustained and compliance is also met. Albert, can you tell me what are you most proud of from this project?
Okay. The thing that I'm most proud of is like when we're about to call or calling the patient and then give them like to follow up on them, and then they're not expecting the call. Oh, you're following me up. It's very nice of you that you have followed me up after the procedure. It's like taking extra mile for them. So they're very happy for that one.
That's
And they're very
excellent.
grateful. Yes.
That's very good. Thank you for sharing that. What about you, Mariam? Anything else you want to share?
I am so thankful for the team because they make sure to do the calls for the patients, and they make sure to send the reports on weekly basis, and that's why we are sustaining our outcome. And thank you for the opportunity to share our project and our outcomes.
Excellent. And as the team mentioned, we have been achieving 100% compliance with our post-procedure phone calls for the pain clinic. And this has helped enhance their patient care as well as the experience, as it's also shown in our patient experience survey for pain clinic. Thank you so much for joining in today, and we hope to see you in the next podcast. Thank you, team.
Thank you so much.